Joining me now, Dr. Celine Gounder, who is a member of the Biden-Harris Transition COVID-19 Advisory Board, as well as an infectious disease specialist and epidemiologist at NYU and Bellevue Hospital in New York. Dr. Gounder, thank you very much. Let's pick it up with what Richard was just reporting. You would think that that would have come up in all of the phased trials already with those who are getting the vaccine, because that's such a noticeable reaction.
Well, I think it's important to understand that when we do these phase 3 clinical studies, we are actually intentionally excluding certain populations. So people who've had severe side effects, pregnant women, children, they were not included in these phase 3 clinical trials. And in fact, the way the vaccine is approved for use right now in the UK, they are recommending, even prior to these allergic reactions happening, they were recommending against giving them to people who've had severe allergic reactions. Now, you're going to have some people who will slip through the cracks for one reason or another. Maybe they forgot about a reaction. Maybe they really just want the vaccine. So for people like that, we do need to be on the lookout. They do need to be observed by healthcare workers and have an EpiPen on hand.
That is an interesting point. What about people who already get the flu shots and other shots, pneumonia shots, and have had no problems with it, but do have other allergies, penicillin, let's say, or food allergies?
Yeah, if you've had a history of a severe allergic reaction, regardless really of the trigger at this point, we would recommend against getting vaccinated with the coronavirus vaccine until we have a bit more information. But this is something we are going to be following, monitoring as vaccinations unfold. And we will start to see studies in other high-risk populations, like I mentioned, also in pregnant women and children eventually.
And you don't think it would hang up the anticipated emergency use authorization coming from FDA as early as Thursday, tomorrow?
I don't believe this is going to hold up the emergency use authorization. I think we just need to be careful about who it is that we're recommending vaccination for, and that there are certain groups where we don't necessarily have the data. I also think bigger picture, you are going to have people who, say in a month from now, who are going to have a heart attack no matter what. And just because between now and then they might get a coronavirus vaccine does not mean the vaccine caused the heart attack. That was going to happen no matter what. And so I think we need to be very careful about whether some of the reactions or side effects, quote unquote, that we observe in the coming weeks as the vaccine is rolled out are truly related to the vaccine or just a coincidence in timing.
Now, turning to the president-elect's goal, a very ambitious goal, 100 million vaccine injections in the first 100 days. Is that realistic, given that we now know that the Trump administration passed on getting more Pfizer doses, for instance? Are there enough other options, Moderna likely coming behind, but what else could you expect to fill the gap and create 100 doses?
Yeah, so the goal is to administer 100 doses, 100 million doses to 50 million people because it's 2 doses per person. But it's not just the Pfizer vaccine that's in the pipeline. Moderna has already submitted its vaccine for emergency use authorization as well. That one will probably get news on very soon here. And then you have Johnson & Johnson and AstraZeneca that are close on their heels behind. So I think by the beginning of 2021, we'll actually have multiple vaccines that we can be using, and we'll target based on how the characteristics of those vaccines, whether you need a cold chain, this ultra deep freeze or not. That will probably dictate which vaccines end up being used where.
And what about the current surge? We're beginning to see the impact from Thanksgiving. How much worse do you expect it to be in the coming months before we get a larger number of people vaccinated?
Well, I think, unfortunately, in the coming couple weeks, we're going to be contending with the transmission that occurred over Thanksgiving. And, that the genie's out of the bottle on that one. But there's still a lot that we can do even before the vaccines come out. We can follow the public health guidance, wear masks, socially distance. If we're going to be around other people over the upcoming holidays, to do that outdoors. And ideally, really, given how out of control the virus is across the country right now, the advice would really be to try to stick to your household bubble for the upcoming holiday.
Thank you so much, Dr. Celine Gounder. Thanks for being with us today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.